The human brain can only be tinkered with so much, but what happens when we find out we can't fix it at all? In American hospitals, the answer is almost comical. Just put it back, send the patient off, and hope for the best. A single surgery can cost $700,000. And honestly, even more shocking than a surgeon's skill is the hospital's itemized bill. The ER treats even the simplest injuries like a life or death crisis. A doctor hands you a Band-Aid, $4,500. Patients don't even dare give up the ghost, because you still need the energy to jump out of the ambulance. After all, a 6-mile ride can cost 90,000 yuan. Even snakes feel guilty after biting someone. Here, one bite costs 2 million. Looking across the entire country, America spends 5 times more on healthcare than on the military, about the size of Germany or Japan's entire GDP. Americans alone spend half of the world's total healthcare money, yet their life expectancy ranks near the bottom among developed nations. Today, more than 100 million out of 340 million Americans carry medical debt. 60% of personal bankruptcies are linked to medical bills. The crazy part? 60% of those people actually have health insurance. So why isn't health insurance doing what it's supposed to? And why should we be cautious about letting privatized healthcare expand without limits? Let's take a look at the American story, how supposedly benevolent institutions quietly attach themselves to taxpayers, draining them in ways that feel almost mundane. Was insurance created to save the poor? Or simply to keep hospitals alive? The Roaring '20s came to an end, and the Great Depression hit hard. Wall Street collapsed, people avoided hospitals because of the rising costs, and unpaid bills piled up. Baylor Hospital was weeks away from bankruptcy, running a deficit of $1.5 million. So how do you get the public to loosen their grip on money? Insurance companies back then avoided health coverage. Death was clearer than illness, and sickness was hard to define or price. But Baylor had one key insight. Teachers spend around 15 cents a month on medical care. So Baylor created a simple deal: pay 50 cents a month and get 21 days of hospital care. It worked. And unknowingly, they became pioneers of the American healthcare system. The plan expanded nationwide, and by 1940, it became Blue Cross, covering 6 million people. It saved hospitals, but it also helped the public. October 2nd, 1943. The government froze wages and prices. Employers couldn't attract new workers with higher salaries anymore. Suddenly, business-provided health insurance became a golden ticket, because benefits weren't counted as wages. Buying insurance for employees was basically a secret salary raise. Blue Cross had a loophole that commercial insurers quickly exploited. As a non-profit, Blue Cross had to accept everyone in a group regardless of age or condition, with everyone paying the same premium. But commercial insurers could cherry-pick the healthiest people and offer lower premiums. In just 2 years, private insurers exploded in growth. November 1945. The war ended. The president who authorized the atomic bomb proposed a universal healthcare plan, simple, direct, even offering subsidies for low-income Americans. But just like with Roosevelt, this idea looked like a joke to many. Was this still America? Opposition united instantly. Insurers opposed it, the American Medical Association opposed it, Republicans refused to support it. And even segregationists opposed integrated hospitals under the guise of equality. The AMA charged each doctor $25 in lobbying fees and rallied 1,800 organizations. They warned that healthcare reform was socialism, a first step toward full government control, claiming Truman was following Moscow. Ironically, the only thing Truman achieved was the Hill-Burton Act, which funded hospital construction, but those non-profit hospitals still ended up in private hands. 1961. The failure of Truman's plan cleared the path for private capital. Commercial insurance now dominated. Even Ronald Reagan, who once supported Truman, switched sides, joined the Republican Party, and spoke out against socialized healthcare, perfectly fitting his movie star acting skills. Housewives adored him, and many believed every word. If I didn't know his father-in-law was the AMA's president, I might have believed him too. July 30th, 1965. At the Truman Library, President Johnson officially signed Medicare and Medicaid, designed for the elderly, disabled, and the poor. Truman, trembling with age, received the first Medicare card. After 20 years, he finally saw part of his dream become reality, a country controlled by capital finally taking a step towards serving its people. But of course, the government took on the most expensive groups, those private insurers never wanted: the elderly, the sick, the disabled. Doctors protested fiercely because reimbursements limited what they could charge. As always, the government compromised. Doctors could still bill higher than reimbursement rates, and patients could be charged the difference. A watered-down reform became law. Over the next decade, Medicare payments to hospitals skyrocketed from $30 billion to $370 billion. Patients didn't feel it, because the government paid the bills. Hospitals shifted costs to private insurers, and insurers responded with apologies, premium hikes, more claim denials, selective hospital networks, and pre-authorization requirements. New mothers were allowed just 1 day in the hospital after giving birth. The public pushed back hard, yet costs kept climbing anyway. Insurers noticed something. Hospitals were incredibly profitable. So why not invest in them? Together, insurers and hospitals could truly make America great again. By 1994, even Blue Cross and Blue Shield couldn't survive as non-profits. They transitioned into for-profit companies and entered the stock market to cover deficits. Reagan's neoliberal era had left healthcare fully to the marketplace. Mergers, monopolies, mixed operations, price hikes. Why isn't there a cure for diabetes yet? Because lifelong treatment is more profitable. A cure would wipe out insulin pumps, monitors, and high-margin supplies. Drug prices can skyrocket 50-fold overnight because pharmaceutical companies, PBMs, and insurers all take a cut. Looking back at 1981, when Reagan took office, the US wasn't so different from other nations. More spending meant more lives saved. But since then, we've run far ahead, spending the most while earning some of the worst outcomes. Healthcare now consumes nearly 15% of America's GDP, one of the largest industries in the world. As we wished, the system has become more expensive, more complicated, more fragmented, and nearly impossible to change. Any reform must satisfy every powerful group. But the truth is, this destiny was set over a century ago. In 1899, New York even classified free clinics as misdemeanors because free care supposedly weakened the poor's self-reliance. In medicine, there's truly nothing new under the sun. The two-party tug-of-war, the failures of government and markets, these forces created American healthcare and will continue to haunt it. The rules don't change. The cycle doesn't end. We treat the American disease. And that's all for this video. Thanks for the likes and follows. See you next time.